Hello and welcome to part 2 of lower extremity pathology. We're going to begin part 2 discussing some fractures that I'd like you to be familiar with. Here's a list of the specific fractures that we're going to discuss: the March fracture, calcaneus fractures, a trimalleolar fracture, POTS, tibial tubercle, and a stellate fracture. Now please note all of these are not found at the end of your chapter in the pathology section, but some of them can be found in chapter 15. Let's begin with the stress or March fracture. A March fracture is the fracture of the distal third of one of the metatarsals occurring due to recurrent stress on that part of the foot. It's more common in soldiers, hence the name March fracture, but it also occurs in hikers or people who stand or walk a lot for their occupation. March fractures most commonly occur in the second and third metatarsals of the foot. You can see an example here in the second metatarsal, again occurring in the distal 1/3 of the bone. The March fracture is a common cause of foot pain, especially when people suddenly increase their level of activity or again spend a lot of time on their feet. So just note, this is a non-traumatic fracture. It occurs due to recurring stress. Okay, there are several fractures that can affect the fifth metatarsal. So patients can have a basic fracture of the mid-shaft here that you see here, and that could be from a fall or some type of injury. But I'd like to introduce you to a Jones fracture. A Jones fracture is a fracture of the fifth metatarsal near the base. And this fracture can happen when you increase your level of exercise. Maybe you increase pressure on your feet because you've gained weight or you've started a new job where you're walking more. Or maybe you're a cross-country runner and you run on uneven ground. Those all can lead to this base fracture here, this Jones fracture. Lastly, you can have an avulsion fracture of the tuberosity of the fifth metatarsal. And we've seen avulsion fractures before. Just remember, an avulsion fracture occurs when a fragment of bone is separated or pulled away by the attached tendon or ligament. Okay, so please remember, a Jones fracture is a fracture of the base of the fifth metatarsal. Here's an example of a Jones fracture here. Okay, and then this could be an avulsion fracture of the tuberosity of the fifth metatarsal. So calcaneus fractures are kind of interesting. Typically they result from a fall from a significant height and landing on one's feet. And you can see here's a large fracture here, and then this is the plantodorsal projection. And again, you can see fracture line here, and there's some here. So quite painful, as you can imagine. And here would be an example of how they'd repair that type of calcaneal fracture. So you can see it involves lots of hardware and screws and plates to try to keep those fragmented pieces in place. So not much to know about a calcaneus fracture other than typically these are seen in patients who fall and land on their feet. While we're talking about the calcaneus, I wanted to share an example of a calcaneal spur. And layman's terms for this condition would be a heel spur. This is a rather common condition, and you can imagine this is quite painful when patients are walking or bearing weight. Heel spurs are actually a calcium deposit that builds up on the bottom of the calcaneus, and it literally just looks like this little hook here. So watch for heel spurs next time you do a lateral foot. All right, let's take a look at a few additional lower extremity fractures. The trimalleolar fracture. So a trimalleolar fracture is a fracture of the ankle joint involving the medial and lateral malleoli, as well as the posterior lip of the distal tibia. Okay, so you can see here we have got the medial malleoli and the lateral malleoli. And then when you do the lateral, you can see sure enough there's a fracture of the posterior tibia as well. So the name trimalleolar kind of gives it away that there's a fracture in 3 different places in this ankle. Okay, a POTS fracture. A Pott's fracture is a complete fracture of the distal fibula with major injury to the ankle joint. And typically this involves ligament damage, and you may even see a fracture of the medial malleolus as well. So here is your fibular fracture. Here is your medial malleolus fracture. And then notice how the tibia is so displaced off of the talus. That is a result of a ligament injury. So this is a pretty bad soft tissue injury. Okay, so Pott's is distal fibula, injury to the ankle joint itself, and then possibly a medial malleoli fracture as well. All right, a tibial tubercle fracture. This is a break or a crack at the tibial tubercle. You can see that here. This tibial tubercle here is broken away from the bone completely. Remember, the tibial tubercle is where the patellar tendon attaches. The patellar tendon attaches to the tibial tubercle, and then it goes up over the patella to our quad muscle in our thigh. In a tibial tubercle fracture, the patellar tendon actually pulls off that whole piece of bone, that whole tibial tubercle. Now, this is a sudden injury versus, remember Osgood-Schlatter? We talked about that in part 1. Osgood-Schlatter is a chronic or ongoing inflammation to that area, whereas a tibial tubercle fracture is a sudden acute injury. Okay, so these patients are typically unable to straighten their knee at all because that tendon has been released, and it's very difficult for them to even bear weight on that leg. Okay, the last fracture type that I wanted to discuss is the stellate fracture. A stellate fracture is a fracture that has a star-like pattern. The fracture lines radiate from a central point. And you can see I've included examples of patellar fractures here because the most common place in the body that we see stellate fractures are in the patella. So here is an example of a stellate fracture here. Again, you'd have like the central point with the fracture lines radiating out. Okay, and this can be caused when like in a motor vehicle accident, when knees hit the dashboard. Yes, okay, so just in review though, remember the other types of fractures, because certainly we could see a green stick, spiral, transverse, compound. Those are all fractures that we could certainly see in the lower extremity, but I wanted to introduce you in this presentation to just a couple specific fractures to be familiar with. Also, as we conclude part 2 here, your textbook lists some other lower extremity pathology that I did not discuss in this presentation because we were introduced to these pathologies in the upper extremity chapter. However, you know, we could certainly have Ewing sarcoma in the lower extremities. We could certainly have osteosarcoma in the lower extremities. So while I didn't cover them again here in this presentation, they are fair game on the test, and they are important for you to know. So if I were you, or may I suggest that you review these and maybe find a helpful way to categorize them. So chondrosarcoma, anytime you see the word sarcoma, that's malignant. Chondro referring to cartilage. This enchondroma is going to be benign. So osteochondroma would also be benign. Sarcomas, again, would be malignant. So find a way to review these and then maybe include them on your study guide just in case. Okay, so that brings us to the conclusion of lower extremity pathology. If you have any questions about pathology, please don't hesitate to reach out. Thank you.